So treatment considerations, some factors that we need to look at. These are very important to look at if patients are going to stay in treatment. So if you take into consideration the family, they might stay in treatment. If you give them a sense of personalization, tell them a little bit about yourself. And it doesn't have to be full disclosure, but something to help you feel more personally connected and human. Having confidence, confianza, which means that they can trust you, treating them with dignity and respect. Also be aware that outside influence can influence their health, so they might go to their neighbor, to somebody on the block that has some information, and they'll probably believe them before they believe you. Specific goals for treating, I separated this into mind, body, and soul. So one of the quotes here is, the mind is very powerful. I think that it's just like believing in your principles. They're beliefs, like a cultural inheritance. So eliciting the pain behavior, life narrative, increasing the sense of self-efficacy, control, reduced catastrophic thinking, setting realistic expectations, always considering what their resources are. So you might not try to find the same resources with a Latino patient that you would give to an Anglo patient that has access. You want to think about what is in their reach. Problem solving and goal setting, cognitive restructuring, seeking internal resources, which is often very strong. I always tell people, think about what got you through tough times before, and let's pull that back out again. And then behavioral activation. Body, helping patients acquire information about their condition is the key component to therapy, to treatment with pain, helping them understand why they have pain. I've had so many patients after they go through a group or pain management treatment say, why didn't they tell me this at the beginning? If I would have known this is what it was, if I would have known this is what had happened, my life would be different. But then, 3 years later, they're depressed, they've lost their house, they've lost their family, and it's going to be a lot more difficult to try to fix that. Integrating use of biomedical and complementary, and then working with their other providers is a key treatment. I sometimes say that I spend more time being a social worker than I do a psychologist, because I find myself making calls for them and setting appointments, but that is actually very therapeutic. It might not seem like it is, but it's part of building trust, it's part of being respectful and helping them get the treatment that they need. Emphasis on whole person healing. I'm going to rush through these. I know I'm going over time here. Increasing exercise and activity. Again, we're not going to ask them to go to a gym. Not likely that they're going to be able to have access to a gym membership. Going around, walking to the corner store, socializing with somebody, taking their kids to the park, things that are more accessible in their life. Reintegrating into structured and meaningful activities and increasing healthy habits. In terms of spirit, this is an important one. I've started using a lot of, with some patients, you have to kind of assess prayer. I have one patient in particular that at the end of our session we say a little prayer together. And the prayer is specifically focused on giving her pain to God and helping strength come into her body from God. And we end the session, every session that way. We just have a nice little closure of prayer. So acknowledging their pain, acknowledging that they have suffering. Some treatments that I've seen that have been effective: relaxation, meditation, biofeedback, and stress management. And then bringing the family in, trying to increase that social support. Again, this is a combination of the spiritual. You have the Cathedral of Mexico City, Virgen de Guadalupe, and this is more of that combination of bringing in the Spanish colonization of their beliefs, religious beliefs with the indigenous. And I would say ultimately look at our own transference and countertransference. It's important not just as psychologists but as health providers to look at how we feel about working and with this population and what our beliefs are, what our inherent beliefs are about them and how that affects our treatment. So I'll leave the conclusions to you. The diverse group of people, always consider their history, holistic treatment, and then examining personal feelings again about working with Latinos. Any questions? Yes. Well, when I think about educating patients about their condition, is if they have something that in their diagnostics or something that demonstrates this is the condition that you have, whether it's a medical condition that may be causing pain, whether it's an injury that may be causing pain. I spend a lot of time with patients just going on Google and showing them images of this is a spine, this is what happens, here's a muscle, this is what it looks like. So very, very basic education about the body and about kind of physiology and biology of it. So it doesn't have to be this education about this is a somatization disorder and this is what you're presenting. It's more to that basic level of this is how your body is expressing it, and when it does that, this is a little signal that goes up to your brain, and it makes things fire funny, and this is why this is happening. So helping them connect those by just giving them basic language and understanding of the biology of pain. You know, I actually purposely took out assertiveness training from my treatment with Latinos, because what I found is having the family come in and look at the family dynamic is much more important. You know, to try to teach a Latino woman to be assertive with a very traditional man is probably going to be very counterproductive. So we want to increase more of the sense of self-efficacy, more of the sense of self-control, and what they can do within themselves and within their family unit to educate, you know, about their condition and how they can help, but not pushing this, you know, American idea of just being assertive, just tell them what you want, because actually they can be very counterproductive and dangerous. Okay. Thank you.